Hey, what's going on, guys? Now, this video is the things that they didn't tell you about becoming a doctor. And a lot of people are going to face this, and by the time they are in the thick of it, they're going to be wondering if they made the right decision in pursuing medicine. Now, most of these things that I'm going to talk about, most people already know, but there's going to be a striking amount of people that say, hey, I didn't know this. I'm glad I knew this. I'm glad I know what to look out for when it comes to being a doctor. And I think first, the first thing is that uh, the job doesn't stop. Depending on which field of medicine you go into specifically, there are some of them that are shift work, and that's why there's an allure to it. There's a lot of people that go into becoming a doctor to be a hospital medicine doctor, where they basically round on patients in the hospital, don't have to worry about any outpatient duties. There's an allure to that. There's also issues with that too, being that just because you don't have any outpatient per se doesn't mean that there isn't any stressors associated with it. I think one of the biggest ones is the social work, the social aspect of it when it comes to hospital medicine. You'll have some patients that are ready for discharge, but there are some things that are preventing them from going home, whether that's not having enough family support, whether that's them needing to go to a rehab facility prior to going home. But the most important thing is insurance. A lot of times people need certain things to be done, but insurance is preventing them from getting it done, whether that's lack of insurance or lack of the right type of insurance. And that creates a barrier and unfortunately increases hospital stay. But the thing that most people don't know about medicine is that the job doesn't stop just because you're doing outpatient medicine mostly. It just changes the scene. You were working on your patients at home, in the hospital, and then you weren't able to finish all of your notes. Guess what happens? Those notes come home with you, or you have to end up coming to work earlier the day after to finish those notes to get ready for the next day. So be careful in the field that you choose, because a lot of times the work is going to come home. The work is not going to stay in the hospital or stay in the office. And that brings you down to number two, and that is that being a doctor sometimes can mean that you have to sacrifice who you are for the betterment of other people. And that's, I think, is what we internally believe, but it's 100% not true. I think your health is just as important as your patient's health, but in the stress of trying to become a doctor, you ignore that, and you see a lot of people gain a lot of weight during medical school or during residency, fellowship training. You see a lot of people deal with mental health issues during that same training. And unfortunately, you've seen a lot of individuals take their lives because of the stress of being a doctor, the stress of having to balance the multiple roles that you may have, whether that's being a doctor or a mother, father, son, daughter, or caregiver, and it can sometimes be too much. And to battle that is just to talk about it more and to let people understand and know that they matter. Your health matters, your mental health matters, your physical health matters. So in addition to being a doctor and telling people the importance of exercise, telling people the importance of nutrition, you yourself have to be someone who believes in it and also acts upon it too. I find myself, especially during my inpatient rotations, dear goodness, everything that I say not to do, I end up doing when it comes to my health. I don't work out as much as I normally do, which is anywhere from 4 to 6 times a week. It ends up becoming 1 to 2 times a week. I end up not making the best nutritional choices because I don't have enough time in my mind to make those choices, which you have to remember that you do. There's a lot of my colleagues that bring their own food. There's a lot of my colleagues that still make the appropriate decisions when it comes to their health, even in the thick of the training, even in the thick of the work. And number 3 is work-life balance. You have to understand that you are more than just a doctor. You are more than just a healthcare provider. You are a father. You are a son. You are a parent. You are a guardian. You are a friend. So you need to keep up those I want to say diagnosis. You want to keep up who you are other than just being a doctor, because if you put everything into being a doctor and things don't go your way, you may find sometimes that you are feeling like you are a failure when in fact that you're not, but you've put this job in a place where it never was intended to be. So continue to be a dad, continue to be a sibling, continue to call your friends and check in on them and see how you're doing, continue to do the things that you do, continue to make habits so that even if you don't want to do a certain thing, whether it's game night, whether it's fun family time, you create a habit of it that even if you don't want to, you are going to do it. I think those are the three biggest things that we sometimes fail to understand or to prepare ourselves for when it comes to being a physician, when it comes to working in the health field, and far too often people are quitting medicine or doing something worse. So it's important that we continue to have these discussions. It's important for us to understand that you were, one second, understand that you are not alone. Understand that there is more to medicine. There is more to life than just practicing medicine. You are more than just that MD, DO, NP, PA. Hope I'm not missing anything. PhD, MS. You're RN. Let's go. You're CRNA. I'm just gonna keep on going before I get called out. But you are more than that, and I hope that you guys. I hope that I find peace in understanding that I am not perfect. I'm never going to be perfect. You are never going to be perfect. But what I am going to be is a good doctor, but also a good husband, a good son, a good friend. There's a lot of people that I need to catch up with. Right now, I'm about to head to the store to get some food for our kids, to create a system for them to get used to knowing that at a certain time it's going to be family time, dinner time. So my kids are very picky eaters. So today it's going to be chicken nuggets and fries. Don't want to get it from the fast food, so we're going to make our own and try to make it as healthy as possible. They are some picky eaters. We already have some broccoli and some salmon at the house that was just made today. I'm hopeful that this combination of having this will help with them. We'll see.